Yeah, hi, I'm Dr. Robert Mogum, and this is Mitch. Well, thank you for your service, first of all. This is a retired airborne Army vet who came to us approximately 1 year ago. This is his anniversary in January. Complaining mostly low back pain, mostly on the right side. He started experiencing these challenges in the 1990s. Since that point, it's been an issue for him. It's caused quality of life issues, functionality issues, and so we started this journey about a year ago trying to find where his pain generators are coming from. And one of the areas that we identified was the superior cluneal nerve. It's the superior cluneal nerve entrapment, actually. But it took some time to get there, and I want to allow Mitch to tell us a little bit about his kind of pathway through Colorado Pain Care and how we got there today, and what type of options now we have in front of us, which we're going to be doing today, a peripheral nerve stimulator, and we're going to be permanently implanting because we just completed a trial that was pretty successful. So I'll let you, Mitch, talk a little bit about the trial and your experience.
The whole reason I was referred to the pain clinic is because the only thing that seemed to be working were some of the more powerful meds, and I just wanted to get off of those and find a new way to try to deal with the pain if we could. And so one thing led to another, including the discussion for this possibility. So I had to go through different steps to verify which nerve was really the one so that they could target it properly. And the trial worked pretty well. I squirm a bit, and so some of it moved around, but we had 2 or 3 really good days in a week where I could see that it was really making a difference. And so that really gave me the confidence to go forward with a permanent solution.
So just a couple things on superior cluneal nerve entrapment. So that's a condition that's newly recognized by pain providers, often under-recognized when we're looking for diagnoses. And usually it's diagnosed by injecting a little bit of local anesthetic right by the nerve, and if they get pain relief, then it helps us identify that that may be a pain generator. And from that step forward, then we allowed us to now go through the trial process using StimWave technology, and that's what Mitch was discussing here over the course of the week. He had very good response with that, and today he's here now for the permanent placement of the peripheral nerve stimulator. Is there anything else you want to add about your experience?
Both the admin and medical staff have been great all the way through, so I'd highly recommend going through this process if you've got pain that is just not working to get resolved in any other way. So I have high hopes for this, and based on the trial, I think it's going to be great. So I'm ready to move forward.
Awesome. Thank you so much, Mitch.
I just had a procedure done last week to have some neural stimulators put in to cover pain that for my right cluneal nerve. And that had really been bothering me probably close to 10 years or more. But in the last year or so, it was getting progressively worse, and I noticed through some of the x-rays and so on that some of my back problems had gotten a little bit worse over the last few years, so that probably explains that. But the good news is that it has taken care of almost all the pain, and it's only been 1 week. As I understand it, this is likely to get even better as I get used to it, and then my body kind of adjusts to it. So I feel like this is a complete success. So even if I end up with maybe a pain level 1 or 2, which is about what I have right now, I could live with that since it was 7 or 8 almost all the time before. It's a bit of a process to go through this because they have to give you some injections to verify where the pain is actually coming from. So they'll deaden that, and then if you feel no pain, they know that they got it the right place because they deadened it, right? Then they have to do it a second time to verify that the first one was correct. Then they know, and each time if it wears off, if you still have that really bad pain, they'll do an ablation, which kind of zaps the nerve to where it can't even feel that pain anymore, can't send that signal or whatever. But that varies for people. That'll last 3, 6 months, sometimes maybe up to a year. Mine lasted about 6 months. And so it just came raging back when the nerves grew back. So then that made me a good candidate for having the stimulators put in. So that was the next step that we just finished last week, and had my post-op today. I took off the bandage and everything looks pretty good. So I would recommend this if you've got chronic pain and don't want to be on meds your whole life. It's a bit of a process to get through this, but it's not a bad process. It just has to take it step by step. And it's sure better than having to do meds all the time. So that's my goal, is reduce my pain and not have to be dependent on medications. And so I would recommend anybody that's got a situation even similar to mine in any way, go get checked out. And this worked for me, I probably would work for you.